So there is a new strain of the bird flu that's kind of going around. It's been in animals, and it has definitely been transferred to a human. It has yet to have human to human contact. I'm going to keep some of my beliefs to myself at this point, just because I have a new channel. But yeah, after what I kind of witnessed in 2020 and beyond, obviously I have some disagreements. Um, I kind of stand. Yeah, I'm just going to keep a lot of that to myself. But it is a concern, I guess, for the left and for the right. Of course, the left, you have to trust the science, gotta trust Fauci, gotta trust Dr. Burke. So we're going to see what Dr. Burke has to say. And as far as the right, well, just know, yeah. So here we go.
Concerning new CDC report on the first severe human case of bird flu in the U.S., samples taken from a patient in Louisiana show mutations that could make it easier for this virus to spread from person to person. Now, right now, there's no evidence it's been passed along to anyone else, and the CDC says risk to the public remains low. But experts warn a single mutation like this could potentially lead to another pandemic.
The virus may mutate and become more easily transmitted person to person. So, the more this virus circulates and specifically co circulates with human strains, that's going to increase the odds of the virus evolving to more human to human transmission. And that, of course, could signal another pandemic.
Joining us now is Dr. Deborah Birx. You may remember her as the response coordinator for the White House Coronavirus Task Force in the first Trump administration. We are very fortunate to have your expertise as we try to figure out what's going on with the bird flu and what it could mean. So far, 65 human cases of bird flu have been reported in the U.S. this year, all contracted by animals. But now we have this new mutation in Louisiana. How worried should we be about bird flu potentially becoming another pandemic?
Well, I love the way you said 63 cases because I have no idea how many cases there were or are. Because our number one principle in preventing pandemics is detect. And if you go to the CDC website, you can see that they're monitoring more than 10,000 exposures, but they've only tested 530. What does that mean? That means we're not testing enough. And we know from other viruses that a lot of the spread can be asymptomatic. So we kind of have our head in the sand about how widespread this is from the zoonotic standpoint, from the animal to human standpoint. Now, also remember, most of those cases described to date happened in the spring and the summer, not when we had H1N1 circulating right now, when we're running the flu pandemic with throughout the United States. So we have rising flu cases, and now we have still zoonotic events coming. So now you've set up for potentially a farm worker getting H5N1, also getting the current flu strain, and reassorting in that individual. To me, that's almost a bigger threat to these mutations happening in individuals over time.
When you say reassorting in that person, what does that mean?
Okay, so the H5
Gain of functions. No, 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 no. It's definitely not that.
virus, which doesn't adapt too well to our upper respiratory tract and is preventing us from getting infected, but can infect cows and pigs and cats and dogs. So our flu, which has the binding sites for us, for our nasal passages. Viruses are very specific, and so they're very animal or human specific. Now we have human flu circulating. At the same time, we have the zoonotic flu circulating.
And the zoonotic is for our viewers again,
the bird flu, yes.
Okay.
So we have the animal flu, let's call it the animal flu, and now we have human flu co-circulating. And at any time, someone could get both of those unknowingly. And particularly in California, where all the dairy workers now are getting exposed. Flu is rising in the south and into California. So we should be monitoring carefully that dual exposure, because if you get both of the flus at the same time, the H5 flu, the bird flu, could get the genes from the human flu and make it infectious to humans in the same way that our current flu is.
And it could be it could become infectious to humans even if it's not coexisting with the human flu, right?
Well, if it mutates like it did in this
Yes, like in the
individual,
Louisiana
or in the case in Canada. But that sometimes is a random, slower process.
Okay.
But if you have that co-infection, then you can share genes.
Okay.
And that's a really, to me, the spring and the summer where we had all of the dairy cattle to farm worker exposure, we didn't have human flu circulating. So now we're entering a much more dangerous period, yet we're still not testing. And we should be providing tests free of charge to dairy farm workers so they can test anonymously weekly, because they'll want to know if they have both cases of potential flus co-circulating in their own body to protect their families. People are very smart. I find the American public to be incredibly smart. If you tell them the risk and you give them the tools, they will utilize them to protect themselves and their family.
So, given this double whammy that you laid out, do you think it's just a matter of time until there's just a full-fledged pandemic here?
Well, certainly we're setting ourselves up for that potential, which, I flash back to January of 2020,
Right.
and I'm hearing the same words come out of the CDC.
Like what?
Low risk of human-to-human transmission. Didn't we hear that from the WHO and the CDC about COVID? So I think our way through this is to use 21st century technology. Remember, it was the private sector that gave us tests within weeks. We went from 20,000 tests to 2 million tests. So if we got the private sector engaged in our response, they would help us get tests out to all of the dairy farms, all the poultry farms, where they could test both the chickens and the people exposed to the chickens, and then we would know how far spread this virus was. Right now, we're just looking for symptoms again. We should never be tracking viruses through symptoms. You don't see a virus through its symptoms. You see the virus through the test. And we know from COVID, most of the spread was asymptomatic. If we had been testing in January, as many other countries were, we wouldn't have had the spread that we had. So I'm hoping we learn from.
But it sounds like it doesn't. It sounds
That's why
like
I'm
from what
worried.
you're laying out,
Yes.
you don't think this
We
country
did
has
not.
learned from the COVID pandemic.
Our
And there's not a
agencies,
sense of urgency right now.
our
that should
agencies
match the
are
moment.
making the same mistakes they made with COVID. The number 2 principle of pandemic is detect. And the only way to detect for viruses is to test. You cannot see a virus through symptoms. You miss so many cases. Yet we're still talking about flu-like illness. Well, there is no flu-like illness. There's RSV, respiratory syncytial virus that causes croup. Parents know what that is. There's mycoplasma pneumonia circulating right now. There's flu circulating right now, and soon there'll be COVID circulating. Those are all coughy respiratory illnesses that look the same. We should not be tracking illnesses by symptoms. We should track them only by testing so that parents know whether their child has RSV or flu so they can protect their grandparents. And the grandparents can know whether they have RSV or flu or COVID, because flu and COVID are treatable. So we need diagnostic tests out
Treatable.
there. And I know if CMS tomorrow said, you know what, we're not going to pay for that doctor's visit unless you have a definitive diagnosis, we'd have better respiratory tests within 4 weeks, because our private sector will respond. If there's a need and there's a way to be reimbursed, they will make the product.
And this is, like I said, I'm going to keep a lot of my commentary limited. But when you're talking about the private sector, Moderna, Johnson & Johnson, and all of these insurance companies, they're going to make money not only from testing, but from these vaccines. And so, when you're getting free money from the government, or um you're getting paid from our pockets, you know, it's just something to just to be wary of. So make sure you get your double jab, your triple jab, your quadruple jab. Make sure that, y'all mask up. You don't just need one mask, but you need several. So, y'all make sure that y'all stock up, and, whatever the science says, you make sure that you do exactly what they say, because we must trust the science.
I want to turn to kind of looking ahead to Trump's picks to lead the nation's health agencies. As you know, some of them are controversial. At HHS, you have vaccine skeptic RFK Jr., also a big advocate for raw milk. Um, at NIH, by the way, the raw milk is relevant to the bird flu discussion, so that's why I brought that up. At NIH, a doctor who criticized COVID lockdowns. At FDA, a doctor who said the government was the quote greatest perpetrator of misinformation during COVID.
So, of course, we need more lockdowns. We should already be locked down now, just to be safe. Um, we should literally not even allow people in necessary sectors to report for work. Um, yeah, so we should get started now. We should shut down the entire economy. We should shut down the school system. We should shut down everything, because it needs to be done. So I hope y'all savings is okay, because I really don't know if we're going to get another stimulus like how we did last time. So I hope y'all been planning for this. Y'all make sure that you only get your information from the CDC, from the WEF, from the World Health Organization, because, you know, if not, your grandparents may die, and we don't want that.
Do people like this concern you about our preparedness for another pandemic? What's your take?
What I'm really hoping happens is what these individuals represent is a lot of what the American people are thinking right now. So instead of burying our head in the sand and acting like they're over there by themselves and there's not a lot of people who think that way, we need to bring everybody into the same discussion. Hopefully that will happen in the hearings, where we can hear from the individuals and there can be that exchange. And out of that can come people moving more towards the center of the response that we need. There were states that probably over lockdown. And we just have to admit that.
No such thing. All of you need to report to your house, lock your door, shut your windows, and you're not locking down enough, honestly. You really should lock down even more. We should, until we get this virus under control, yeah.
And say, what are we going to do? Where is our school guidance for the next pandemic? That's what we need. We need practical school guidance.
No school guidance. All the kids should report home. All the parents should quit their job immediately so that they can take care of their kids. And you should literally stock up on bleach, hand sanitizer, Lysol, and pray for the best. Maybe your kids will be back on grade level when school starts in the next 2, 3 years, but maybe they're not. And that's only your fault as a parent for not taking the necessary time and effort to homeschool your kids while we are in lockdown. So you should do more.
I was out on the road keeping universities and schools open. How did we do it? Testing. Once a week testing, didn't quarantine, just removed.
Once a week testing is not enough. We need to have daily testing. Anything can happen in a day. You could literally catch the bird flu in a day. Anything can happen. It needs to be minute by minute testing.
The acute cases, and they didn't have any campus spread. So we know how to do it, but we're not using everything that we learned and applying it, because now we're just arguing about individuals on either side rather than saying, let's find a practical place in the middle where we can all agree this is going to be our response. This is how we can keep the schools open. And it really comes down to being able to see what viruses are circulating. That's why I keep coming back to testing.
So obviously you think testing was a miss the first time around, and you think it's a miss right now.
I do.
What were some other lessons learned? Things that, as in hindsight's 2020, as they say, you would have done differently the first time around. As we look ahead to the potential, I don't want to fear monger, but there is the potential of another pandemic here with the bird flu. What do you think the lessons learned should be applied to that? And what should we all be doing right now? I mean, should we just avoid, it's the holidays, should we avoid gathering with a lot of people? What do we do?
No, I think
All of you who went to Christmas and all of you who went out for New Year's, you all are bad, 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 horrible, terrible people, and you are risking the elderly. So lock down. Stay home. Work from home. Don't report for work. Your job probably won't be there when you return, but you saved lives. No herd immunity. That's hogwash. There is no way that the human body can beat a disease. So we must double, triple, quadruple vax. Get the jab today. Be preventative.
to me, testing is fundamental because I have my children test and I have the grandchildren test because we're still protecting people. My mother is 96. She hasn't gotten COVID. She's been in a multi-generational household. So all of these things are possible if you give people the information that they need to protect each other. And I think if what we learned anything from the last pandemic, education is much more important than mandating.
So yeah, achoo. Y'all be safe out there. Y'all make sure y'all lock down. Y'all make sure y'all
Tonight, as
get
President-elect Donald Trump is
another
preparing.
COVID shot. Make sure you get the flu shot. Make sure you get the new bird flu shot. Yeah, can't risk anybody dying. So yeah, y'all be safe. Happy 2025. Peace.